Today, we're diving into something pretty amazing. We're going to talk about how the same tech that's in self-driving cars and chatbots is becoming an honest-to-goodness lifeline in some of the world's most remote clinics. Yep, we're talking about AI in healthcare, and its impact is, well, it's a total game changer. So let's get right into it.
Just think about this for a second. What if the most powerful tool for your health wasn't in some futuristic, high-tech hospital, but was sitting right there, in your pocket? This isn't science fiction, you know. This is what's happening right now, and it's all powered by the smartphone.
And that's really the heart of the matter. For so many places, particularly in low and middle-income countries, AI isn't just a cool new feature. It's essential. It's about bridging these massive gaps in care and literally saving lives where the system is stretched to its absolute breaking point.
To really get why this is so important, you've got to understand the reality on the ground. We're talking about a severe shortage of doctors and nurses. We're talking about people who have to travel for days, just to see a clinician. And when they get there, the local facilities are often completely overwhelmed. It's a huge systemic problem.
Our source material for this explainer puts it in this really powerful way. It says AI is less of a luxury, but more a great equalizer. And I love that framing. The idea is that this isn't just another gadget for the rich, it's a tool that could finally level the playing field for global health.
So when we say AI here, what are we actually talking about? Look, we're not talking about robot surgeons from the movies. Not at all. We're talking about smart, simple-to-use tools, often on a basic phone, that can look at health data and do two things: empower patients and act as a kind of co-pilot for those overworked healthcare workers.
All right, so first up, let's look at how this helps patients directly. The biggest thing here is putting critical health information and safety tools right into their own hands, no matter where they live.
Okay, check out this real-world example. Imagine a patient, maybe someone who can't read well, gets a new medication. They can just scan the box with their phone. Instantly, an AI tool checks for any dangerous drug interactions, confirms the dosage is right, and then gives them audio instructions in their own local language. It even warns them about side effects. I mean, how huge is that? That simple act can prevent so many life-threatening errors.
But it's not just about the patients. What about the people on the front lines? The doctors, the nurses? This is where AI really becomes what some call a force multiplier, giving them a much-needed boost when they're swamped. And the difference is just night and day. On one side, picture a nurse just buried under paperwork trying to figure out who in a packed waiting room needs help first. Now, picture that same nurse with an AI tool. It helps them triage the most urgent cases, gives them an instant summary of a patient's history, and can even offer a second opinion on an X-ray when the closest specialist is hundreds of miles away. It's a total transformation of their workflow. And this is a really important point. The goal here is absolutely not to replace clinicians. It's to help them. The AI handles the routine stuff, the data analysis, freeing up the humans to do what only they can do, which is connect with, listen to, and truly care for their patients. So the potential is just massive. It's undeniable. But, and this is a big but, like any powerful new technology, we have got to be careful. There are some serious risks here that we have to talk about if we're going to do this right. So let's shift gears a little bit. It's time for a reality check. We need to take a really honest look at what could go wrong if we just roll this technology out without thinking through all the consequences. And the data on this is pretty eye-opening. According to our source, only about 12% of these AI tools are considered low risk. The vast majority, we're talking over 87%, carry a medium or even high risk of causing real harm if they mess up or are used the wrong way. The stakes couldn't be higher. Now, when we break that down, something becomes crystal clear. The tools that have the highest risk are the ones that are giving direct clinical advice, helping with a diagnosis or suggesting a treatment. That's where an error isn't just a glitch. It could have devastating consequences for a person's life.
So what are the biggest roadblocks? Well, first, there's data bias. If an AI is trained on data from, say, North America, it could make huge mistakes when used in Africa. Second, there's AI illiteracy. A lot of health workers just haven't been trained on how to use these tools safely. And without clear rules and ethics, there's a real danger this tech could actually make the health gaps we're trying to fix even wider.
Okay, so that leads us to the most important question of all. How do we get this right? How do we grab all that incredible potential of AI while avoiding the very real dangers? Well, the path forward seems to be all about shared responsibility. This isn't a job for just one group. It's got to be a team effort.
Policymakers need to step up and create clear, ethical rules to protect patients. Tech developers need to build these tools with local communities using local data. Educators have to get out there and provide training, and, maybe most importantly, the clinicians on the ground have to remember that they are always the final decider. The AI is a tool, not the boss.
Which brings us to this one final, really big question. There's no doubt that AI can be an incredible tool for empowerment in global health. But at the end of the day, we have to ask, who holds the power? Making sure that power is in the right hands and used for everyone, not just a select few, that is the challenge that will define this entire revolution.